Good evening. Thank you so much for tuning in to the Medical Health Show. My name is MUMBI MAVUTI, and today we are going to be talking about oral health. I'm not alone here in studio. Dr. Kea has joined me. She's going to be educating us more on the same. Thank you so much for making time for us.
Thank you for your invitation.
Yeah.
Yes.
It's a good evening. Are you well?
I'm well. Good evening to all. Yes, I'm well.
Yeah, thank you so much. So you're going to be talking about oral health. So just to understand our topic for our viewers, what exactly are we talking about when we say oral health?
When we speak on oral health, we are in a whole summary. We are looking at it as what should be good of it, and what we should do to prevent maybe the diseases that are in the mouth, so that we can have a better quality of life. Yes.
So before we even talk about the diseases that are in the mouth, all of us, we know that we should brush our teeth.
Yes.
So how often should we?
Oh, to brush our teeth?
Yes.
Okay. Ideally, we are meant to brush our teeth twice a day. I've seen or I've watched from the patients that we normally see, or just from the general community, there's lack of that awareness on how we should brush our teeth. So ideally we should brush our teeth twice a day, and not before meals. It is actually after meals, because this it's just like cleaning. So when you're saying you're cleaning your something that you want to wear, you want it when it's dirty so that you can wash it. You will not use something that is clean it after. You should clean it after it's dirty. So after we eat our food, that is when our mouth is dirty, and that's when we should brush our teeth. So ideally in the morning after your breakfast, and in the evening after. That is the last thing you're going to do before you go to bed. After eating your supper and you're sure you're not going to eat anything, we should brush our teeth. Yes.
So brushing is not for the mornings only.
Yeah, it is twice a day. Yeah.
Thank you so much for that. So we assume that you know how to brush our teeth, and we think we really do. But I want to give you this opportunity to educate us, show us how are we supposed to brush our teeth.
Okay, thank you so much. So there are many factors about brushing your teeth, and I don't blame the community. It's an area that has been neglected, even in the international settings or in the local settings, that we assume that people know about brushing your teeth. So there are few factors that are very important about brushing your teeth. So for example, the brush that you're going to use to brush your teeth, the frequency that you're going to use, which we've talked about, which is twice a day, the force you're going to use when brushing your teeth. Those are important factors that are that will help us to keep our teeth very clean. So I have a model with me today. I'm going to try and use it to demonstrate about toothbrushing. Okay?
Yeah, that's fine.
So let's start with the toothbrush. Nimesikia wananchi wanapendaga hizi zina toothbrush. It looks very huge and hard, assuming that it's assumption that when it's hard, it will be able to clean the tooth better. Okay, so the right toothbrush that you should use should not be a hard toothbrush, because our teeth are not like shoes. You're not trying to polish your shoes to shine. You never brush until they shine. You're just trying to remove the food particles that are around the gum area. So the brush should be soft. Okay, soft texture. When you touch it, it should be soft. It should not be hard. I also recommend, this is a personal recommendation, the head of the toothbrush is also important, because unfortunately in the industry they are made in a standard way, but you can actually find one that is ideal for your mouth, because everyone's oral cavity is different. My mouth could be bigger or smaller than yours, but if I'm using a brush that is too big, it will not be able to clean the important areas, which are your back teeth that we use for chewing. Okay, so ideally we're to look at a small, medium-headed toothbrush, not so big that when you put it in your mouth that you cannot be able to get into. So you actually estimate, okay, looking at this brush, it may be able to get to the last molar teeth that are most important, which are mostly affected with tooth decay. So the head of the toothbrush is important. The texture of the toothbrush is important. Okay. Now, and then the amount of fluoride we are putting on the toothpaste is also important. We are not meant to traditionally, I'm sure people fill it up the whole way from end to end. Kusema kijando itasaidia kuikuwe msafi. But exposure to, don't forget the toothpaste has fluoride in it. Now, with excess exposure to fluoride, because you're putting yourself, or a child especially, at risk of dental fluorosis, which is the browning of teeth. Because the children, what they do when they are brushing their teeth, they do swallow. So mtoto akibrush meno, as they're brushing their teeth, anajipata amemeza hatemi. So the frequent ingestion of fluoride is a slight percentage of what would cause the dental fluorosis of the teeth. So the amount of toothpaste is also important. We're not meant to fill it. You just meant to have enough adequate amount, like maybe half of a toothbrush. With children, depending on ages, when they start, we are recommending they should have just pea amount, like a size of a minji or half a minji on the toothbrush to brush their teeth. And as they get older, like over 3 years old now, a minji size. So you can imagine, you can now check yourself and what you've been exposing your child to might not be the best way to, or maybe putting the child at risk of dental fluorosis. So we said about the toothbrush and the toothpaste. Okay, I'm always asked this question about which is the best toothpaste, and I always tell patients it's not about the toothpaste, it's about how you're going to clean your teeth. It's just the same as washing our clothes. Normally it's never about the detergent. Kuna mwenye atapewa panga na kuna mwenye atapewa expensive named brand, but venye ataosha ndo itafanya ikuwe ingare. So pia meno, it's about how you brush your teeth. It's not about what you're going to use or which toothpaste is best. Okay, ideally should have fluoride in the toothpaste that would to protect the teeth, but no, I will not say which brand is the best. Okay, so looking at my model, this is a mouth, and we want to believe that you're going to brush our teeth. Kienyeji way, mtu I know most people wataingia na atafanya either up or down ama ende across akibrush meno. Don't forget the person has closed their teeth. I'm happy that I brought this model because it will help you to see the mistakes that we do, or the community does, that puts them at risk of having oral health diseases. So if you're going to brush your teeth, let's say this is my brush and I'm brushing my teeth with my teeth together. I want to believe this brush is not covering all surfaces. Is it true? Is it covering everything? No, it's not. So when you do that, and imagine you're doing it across, so there's a place around especially the gum area, that patients normally, or people normally miss to brush, where that's where the food tends to accumulate and starts forming the gum disease. So ideally you should open our mouth, you should brush with your teeth wide open. Okay, choose one corner to start with. So let's start, we're starting the left side, and the motion that we should use is to move the brush. This is the simplest way. There are different ways, but I see this as the simplest way that as a child you can learn and carry it on to adulthood. So by moving your brush in circles. Okay, so if I'm doing circle wise, why I'm promoting the circle part, if you look at our gum line, our gum line is semicircle. Okay, so if I was doing across vertically, do you see I'm missing the gum, the deepest part of it? So we go circularly, and you go round, till you get, this is the outer surface of the teeth you are cleaning. We are going all the way back to the last tooth. Then we focus on where our teeth chew. That is the surface where food stays and we chew. We come in, go round. We have the third area where the tongue normally sits when we close our mouth, which people tend to ignore. We come in this side, take it, and go round this area. Okay, and that's just the upper jaw. So we have to go down to the lower jaw and do the same thing. One corner, go round, and not quickly. I'm just demonstrating in a rush, but not quickly. Brushing should take you about 3 to 5 minutes. You should not brush as if nikitu kupitisha na kwenda. No, 3 to 5 minutes. Slowly, and the force also. the force of what you're not meant to use a lot of force in brushing. When you do that, you're actually eating away the tooth surface at the gum area, that now the tooth will not become sensitive. Okay, so as I was continuing, go round to the back tooth. Come, put your tongue up. Focus on this area too. This area too. Come out. Okay. Spit.
That someone should visit a dentist. Is it only when we have a problem, when we have an oral disease?
No. Ideally, guidelines of some international companies, countries or us, we recommend you should come visit the dentist twice a year. Twice a year at least. Why? Because number one, all health diseases, some of them tend to progress slowly. So if you come at least in 6 months, I'll be able to, as a dentist, I'll be able to pick it up and tell you, okay, this is starting and we can manage it this way. So twice a year we see it's something that is manageable, because that is a window period that you can be able to manage the disease and see where there's an issue, and it's not too long. We don't recommend that, because the real behavior we've noted is that patients come when they're in pain or when they have an issue, and most of the time the issue has already progressed to some state that we may not be able to save, for example, a tooth. So having frequent checkups is a good thing. We're able to identify there's an issue and how we can address it as quickly as we can.
So don't only visit a dentist when you have a problem.
Yes.
Yeah, that's important. Now let's talk about foods. We know, or we've heard that there are certain foods that are good for the teeth and others that are bad for the teeth. So let's start with the good ones. What kind of food should we be taking in that is going to help us with our teeth?
Okay, thank you. Foods that are good for us are almost generally like the general body, where we'd recommend that you take high fiber vegetables and fruits, things that help the body to build up and protect. So fruits and vegetables, things that have a lot of some calcium, because don't forget our teeth are just like bones. They're made of calcium, and they need to be added onto the body. So things that are rich in calcium, something like milk, dairy product, yogurt, those are good. Vegetables and fruits are good. Okay, I'm not. Especially tooth decay. It is, people have always known that has been sugary stuff, and you find that a parent assumes that if I give my child maybe what is sugary is maybe biscuit, just the basics. But I want to expound on that and say that anything that is sticky, sugary, and majority of the carbohydrates that we consume, they put us at risk of having dental disease or tooth decay. Okay, so you can find that the child or us, we're choosing to take something that sugary stuff. When I say sugary stuff, in soda, in the biscuits itself, in the cake, even in right now in the foods that we are cooking. For example, we're eating chapati. It's the someone who's adding sugar. Someone who's having mandazi, there's sugar that's been added to it. There's the people who are now cooking with additional sugar in the food. So that is also a risk factor for us to develop tooth decay. Sticky foods. That I would include that something like, let's use, for example, crisps. Crisp is not sugary. It's not, when you put it, it's salty. But as you chew, it tends to stick to the tooth surface. So yes, sticky foods. There are some chewing gums that are also sticky. Lollipops. In summary, I say most of the junk foods that children eat, that are being exposed to, put the children at risk of dental carries, or even us as grown-ups. Because what happens, we will discuss about how tooth decay happens. The frequency of taking those things is what is making us prone of having oral health problems in the mouth. But yes, so the sticky, sugary, and I'm specifying carbohydrates. Majority, I'm not saying all of them, majority of the carbohydrates that you are eating. Because you'll find there's a child who's in Turkana right now, who's maybe, there are no, hakuna maduka huko, kwao, but maybe the diet that they're eating has something that is high carbohydrate, having high carbohydrate. So unapata, the teeth are getting rotten, but they're wondering why. So we have to shift the mentality from just using the word sugary, and even expand on what sugary part, anything that has sugar added, okay, is something that is going to put us at risk of developing tooth decay.
As Kenyans, we love ugali. Is ugali safe?
Ugali is also sugar, it's a carbohydrate. Yes, so
it is also in that category.
Category. But you see, you can't also tell people not to stop eating them. The main point about the oral cavity, it's about hygiene. We're just going back to the basics of just hygiene. We learned with COVID that at the end of that whole segment, we're just being asked to have our hands clean, which is hygiene. So even tooth decay, as much as we are exposing ourselves to the show, we can't change the diet because that's what is available, but can we focus on the hygiene part, where we are saying brush your teeth twice a day, and the right way, as we grow as grown-ups, can we floss our teeth, because there are people who don't even know what dental floss is. So can we promote that so they can know this is what you should use in between your teeth? I'm not a fan of toothpicks, maybe because of being in practice and I've seen what detrimental factors it does. Yes, initially it does remove the food in between, but eventually it ends up creating, eventually creates space in between the gum and the tooth, now where food as you eat gets stuck. So it's now a repetitive cycle that's not ending. So dental floss is the other option that's there, although it may be expensive, but it's an additional thing that helps us to keep our teeth clean. Yes. And
we have also heard of some foods that will make, I don't know, do I call it hard food, or something like sugar cane, that it makes our teeth strong. Is that true? Yes, hard things would, but also it depends on how hard it is. Don't forget our bodies is being monitored or surviving on the calcium that I am ingesting. Okay, so if I'm not being exposed to calcium products, but then I'm choosing to use hard things, I'm putting my tooth at risk of breaking. Yeah, so it also depends on what it is. But hard in the sense of, I would call that almost a myth. It's not been quantified into heavy details that yes, hard things, but more of, because the teeth is more of calcium and the gum around the teeth that's protecting the teeth to be safe. Yes. So it's I go back to my vegetables and fiber in the food. Yes, more than running to see the hard things. I would not really push on to the hard things, but see the fiber, the vegetables, your water. Yes. So bottom line is that whatever we take, if we brush our teeth properly and as often as we should, which you said is at least twice, that we are going to be fine. Yes, we are going to be fine. If we do it the right way, we are going to be fine. Yes, the problem has been the lack of awareness. People have not been aware of the right way. For example, for us to use that question, who taught you how to brush your teeth? Who taught you? Nobody taught me. So in the common community, it's either nobody or your parent. And your parent is not a dentist or a health professional. Even in the health professions, we treat our colleagues. So this is a real gap we are seeing, that people are not aware of the right way to brush their teeth. So if you can try and focus on that, we can almost try to prevent the oral health diseases that are common. Yes. Thank you so much for that. I think we are learning quite a lot. So that is it about brushing and keeping our teeth clean and hygienic. But then there is this other problem a lot of people complain about, bad breath or halitosis. How does that come about? And
Okay. So halitosis is a medical term used to describe bad breath, something that has been persistent, a persistent bad breath, and it has different there are different factors that contribute to bad breath. So let's start with in the mouth. There are factors that do contribute, and I told you that when I talked about brushing. If we do not brush our tongue, all the foods and the smells, let's use the word smells, for example, garlic and onion, does remain on the tongue surface. So if you're brushing your teeth but don't brush your tongue, that which is poor oral hygiene, you're putting yourself, you present as having bad breath. Gum disease also, as it progresses from gingivitis to periodontal disease, does present with bad breath. Okay, a patient who's having a hole in a cavity, what you call a tooth cavity, as they're eating, because it's a hole, as you're eating, you're packing the food into that hole as you're chewing, it will remove a smell. So the person will find they've been told there's a bad smell that's coming from, it is all from the tooth. We can have a patient who's maybe there's an infection patients normally do get after we do tooth extraction that presents you also with bad breath. So those are some other disease that may be having an issue. Someone who's wearing a denture, if they're not cleaning their dentures properly, once they remove food harbors under the denture, so that will present as bad breath also. So that is in the intraoral. But we also have now past the mouth, where it's related to now.
Just a minute before we get there, yes. What's a denture?
Oh, sorry. A denture is the false teeth that people wear, so to replace the tooth that they're wearing, so something that comes with teeth and something pink, where most probably old people do wear, but even young people are wearing now, that it's a replacement of teeth, but it's something that you can wear that's actually replacing the missed tooth, that tooth that you're missing in your mouth. So that's what a denture. So some people will find that because they are so comfortable with it, and maybe they're shy to remove it in front of a partner or the family, they stay with it the whole time and don't remove. So as they're eating, food will enter in between and harbor in between that place and can present with bad smell. Yeah. So we're talking about past the mouth. It's related to what we call respiratory or ENT. So a patient who's having maybe throat infection, tonsillitis, because there's a smell that will come out. Maybe a chest, even bronchitis or chest infection, they present with that. And in a patient with a gut or GIT problem, that you find as they burp, there's a smell that will move and will come out as bad breath. Yes. So
you're going to be talking more about that complication and many others, but first you're taking a quick break here at Medicamp. Stay tuned, don't go away, we are going to be right back.
Michael Gaido Jungu. I'm the principal Madenge Technical Training Institute, which is a national institution in Udaya, which is in Nyeri County. On 10th of February 2024, that will be a Saturday, we shall be hosting a career day at Madenge TTI, and this event is to inform the would-be students at Madenge TTI of the courses that we offer. We want them to receive first-hand information about the courses offered at Madenge TTI, and would like to tell them about the assessment of the courses that they are running, because we are going to concentrate more on assessing the practical skills rather than the theoretical skills. Majority of our parents and the public at large, they are not aware of what is happening in Tibet. So we have invited various government agencies to come and explain to all the participants about what is happening at Madenge. This event will be graced by our area MP, Honorable Wainaina, who is going to be our chief guest on that material day. Thank you and welcome.
You ought to join Madenge Manzi. Come, some award.
You'll get to learn more and explore more on the career that you choose. This is the place to be.
Feel the love this Valentine's with GTN TV. Nominate a special person in your life. Tell us why they deserve to win a prize to appreciate them during this Valentine's Day. Send us a text message or WhatsApp stating their name, contact, photo, and why to 0725 737 228. The most touching message will win the grand prize. Feel the love this Valentine's with GTN TV.
Omobuge wa thaya wa Mbogo wa Inaina gukua augaga nĩ kuga na gwĩka na gĩtĩo kĩnene nĩ rakũnyita ũgeni we mũrutwo kana mũciari kũrĩa Mathenge Technical Training Institute nĩ thĩinĩ wa Career Fair Day nĩ Jumamothi tarĩki 10 mweri tũrĩ wa kerĩ mwaka wa 2024 kũrĩa mũrutwo agateithia thĩinĩ wa ũcagũri wa kothi na ũtaũku makĩria gwakinya nĩ kothi cia moko maya mothe makahanĩkĩra kĩharo-inĩ kĩa Mathenge TTI inyuothe mũrĩ anyite ũgeni.
Welcome back. Thank you so much for staying tuned in. We're talking about oral health. In case you're just joining us, we've been taught how to brush our teeth properly. We've been told what kind of foods to eat, which ones to avoid. And now we're talking about some of the common conditions that we have with oral health. And we're talking about bad breath or halitosis. And now we know how it comes about, but doc, we don't yet know how to manage it. How do we manage it?
Thank you. So management needs for us to identify what is the cause of the bad breath. As I said, it could be from the mouth, it could be related to another part of the body. So once we identify where it's coming from, then that's when we're able to manage it. I would advise for maybe the patients to come to visit a dentist, let them have a look in your mouth, so you can be able to tell you, is this from the mouth or not? If it is, then they tell you the right how they could manage as a dental or oral health condition. But if it's not that, then you might find this referral to see another medical practitioner who may be able to assist with that issue. Yes, so it's not something that in one a comprehensive way that can be done, but we have to identify where is the problem coming from, then we're able to address it and manage it. Yes.
So, you know, a lot of people that believe or maybe have been told they have bad breath, they struggle with esteem issues because they think it can't be dealt with, and I think it is very important that you have brought it to light that it can be managed.
Yes.
But then again, is it possible for someone to believe or think they have bad breath when they don't?
Thank you for that question. I will speak from my personal point of view, and yes, I've seen a couple of cases where you find that the person has misunderstood or has been told, maybe someone close to them, that they're having bad breath. Well, they actually don't have. So yes, you might find which we call imaginary. It is not it's not actually there, but they imagine that they're having a bad breath, and you find they'll even complain about a body odor. They find that maybe the smell of sweat and other issues. So it is an imaginary one, which that is something that maybe we'll deal with counseling. Yes, the ones who are assuming that they have, and there's no issue, we check them, and there's no plaque, there's no something that would be causing this. Yes, there are people who have that. Yes,
and it also has a solution.
Yes.
Thank you for that. So another condition that is common is tooth decay or dental caries. Break down for us what exactly it is and how it comes about.
Okay. So tooth decay is one of the most common oral health conditions globally. As you started, you say that tooth decay is affecting, in 2019, it's affecting about 350 million. 350 or 35 million. In Africa, we were having, by 2019, recently we had about 480 million people. Now, tooth decay is a condition that arises from the bacteria in our mouth. Okay, so I want to practically, let's go into the mouth and see how this works. So when we ingest food, when we eat food, especially now, as you said, we say the sugary or the high carbohydrate food, we are not just feeding ourselves, we are also feeding the bacteria in our mouths. So when the food enters our mouth, what happens with the increased saliva so that you can be able to chew the food and break it down. But as it's doing that, the buffering, the work of the saliva was to buffer. When I say buffer, is to protect the outer tooth surface of the tooth. So as we're eating sugar, the bacteria are like, hey, there's a party in the mouth. They get food, and what they do is they produce acid as the product of the food they've consumed. So that acid tends to go to the tooth surface, the outer tooth surface, and now attacks it and starts breaking it down. So that is what is tooth decay. Okay. Now the problem arises when the frequency, and that's when I went back and I told about the frequency of what we're eating. The sugary stuff is the issue also. Because this process of once the food is in the mouth, it takes 40 minutes for it to, the whole process of it produce the acid and for it to go to a plateau and come back down. So you can imagine if you're eating 40 minutes and times 2 for it to come back down, so make it about 80 minutes. And we are frequently eating. So you had breakfast at 8 o'clock. By 10, you want to have your tea and mandazi or snack. 12, you want to have your lunch. So if you're having that frequency, you're not giving the body or the tooth time to build back up to protect the surface. So the acid, and once it breaks down, it does not build it back up. It continues. So it continues. It becomes a cycle where now it's breaking down the tooth surface to become a whole cavity now. Presents in the mouth. Yes.
And mostly we are coming to the hospital with this when we have a toothache.
Yes.
How soon should someone come to the hospital? And is there another way to manage this? Because I think most of us will come to you, will not even ask for treatment. We'll tell you, nitoe meno inanisumbua.
Thank you so much for saying that. Yes. In my way, I like to equate tooth decay similar. I'm not saying it's the same, similar, the progression similar to almost like cancer. When cancer starts, it's very silent. It does not have many warning signs to tell you there's an issue. But as it progresses to the last stages, that's when it's like it's having the symptoms of pain and discomfort and all that. So it's the same as tooth decay. As it starts, it's very silent, you will not even notice. But you may find as it progresses, the patient will tell you that, okay, I was feeling some sensitivity to something hot or cold. And to go, just a spontaneous thing, a spontaneous sharp pain that came and went. They'll tell you maybe food is getting stuck in between that tooth surface. So yes, those are the early signs of it. Now, as this progresses, the hole is progressing. It's trying to, the hole is progressing to kukaribia. Let me ask, to karibia, to get close to the nerve area. Well, now by the time it's getting to the nerve area, that is when now the patients, you're coming to us either with the throbbing pain, that this pain is throbbing. I can't take anything hot or cold. At night I cannot sleep. Now another factor about at night you cannot sleep is because of you've eaten. Most people have the practice of brushing your teeth once a day. You brush in the morning, you have in a hole, you've been chewing the whole day, so you've been packing food, packing. You didn't ukapanda kitanda, ukalala. So yes, now you've, that's why I was giving the example of the bacteria, like, yay, you fed me. So yes, so now the pain is continuous at night. So yes, so that's what happens with tooth decay. We go back to the first recommendations. I say that the dental visit should be twice a year. As you start, when you come see me, because tooth decay takes a progress of 2 years for it to fully manifest, and it's at the worst stage. So when you come for the checkup every 6 months, as a dentist, I can be able to check your tooth and tell, I'm noting a hole is forming, and we can address it there. We should put that is the best time to put fillings. Those are the times that, because we find patients are getting frustrated that they're coming to us maybe, and it is already at the the worst stage is paining so much, the hole has gotten to the nerve area, they're being told they need to be done root canal treatment. So as it starts, when the hole is small, we don't have to jump into root canal treatment. I'll put a normal filling for you that actually has the probability of lasting longer than a big hole that is being filled. Yes, yes. Yeah.
And is removal of the teeth, is it the best option? Because I don't know, unless a dentist advises the community or majority of us feel like if my teeth or has a problem, I only want it to get removed. Is that the only option to?
No, it's not the only option, but this is not also it's a community problem, or it's not actually even the community's fault. With the lack of having dental professionals to seek care, the options was, or even if you did go, you might find that the facilities may be previously did not have room to have fillings to be done. So yes, tooth removal was the most common practice, but for now, I would suggest it all depends on how bad the tooth decay has affected the tooth. So when a patient comes to see us, we'll be able to tell you, like, looking at this tooth surface and how much has been distracted, yes, the option is to remove it, or no, this tooth can be saved by being done root canal treatment or a filling or whatever treatment that may be available. But jumping to tooth extraction is not recommended. At least let it be seen, judged by a dental professional, then hear the advice they're giving you, then you can now opt for the tooth extraction. Yes.
Now, I don't know if this is a myth, but it is also something that has been said a lot, that salty water has an impact on our teeth. Is that so?
On our teeth, on tooth decay? Yes and no, because it depends on the severity of the condition which comes off after the salty water. So people who are exposed to too much salty water present with a dental condition called dental fluorosis, which is the browning of the teeth. But with the dental fluorosis also, there are different levels. There is the mild, there's the moderate, and the severe. So you may find one who's just having a light brown, there's one who's dark brown, and there's one who's really dark brown. Now, the problem with the moderate to severe is that despite just having the dark brown, the tooth surface has porosities, like holes, like it's chipped out. So that does provide a surface for food to get stuck. Now, if you're saying this person is also just brushing once a day, like the common wananchi, yes, the teeth will tend to get rotten quickly. Also, the discoloration tends to camouflage. So the person, as they are brushing, they are not able to differentiate a normal tooth surface and the one that is decayed. So they can't tell you that the hole was there, because the color of the tooth that is having the hole and the normal color of their teeth is similar. Yes.
So another problem we might have as a community is that sometimes we have issues with our teeth. We are having that pain and we rush to the chemist and we buy painkillers, and it stops aching for a while. That happens again, we go back. What do you have to say about that?
It's a common practice that we see. We call it self-medication. And again, it's because of lack of awareness. So as I've explained to you, if you come have your dental checkup every 6 months, I can be able to tell you this problem is starting. So that we don't have to wait till it gets to that severe part. Number two, don't forget, people have the mouth is a very sensitive part. Even me as a dentist and a patient, yes, the injection in the mouth is not something very comfortable. So patients you find they have traumatic experiences, so they are scared to come to the dentist. They've assumed the dentist is it's a global thing. We've been assumed we're associated with pain. A dentist has been associated with the pain in the mouth. So the patient finds that normally first self-medicate and look for confidence too, then I'll go there when it's really, really bad. But I would really ask them to not to do that, because one, when we self-medicate, at the chemist, you find that because of dental or oral conditions of infections, they are going to be given antibiotics. Now, you can imagine having a year, you may find someone can stay 1 year, avoiding to go to the dentist, and has been taking antibiotics continuously. Like after a while, then the pain comes back, they take the antibiotics. So this is exposing the patient to antimicrobial resistance, which we are seeing is a global problem right now, where now they find that the time they want to take that antibiotic will not work. Okay, number two, you're almost using money. That is money. When you go to the chemist, you're using money, which if you would have just gone and have that tooth be addressed or looked at, we are now reducing the cost of the problem. Number three, you might find cases like, for example, if it's, let's say, oral health carcinoma or cancer of the mouth, the patient has now, we've lost time that if when it had started, would have dealt with it, we were able to manage it. Now it has progressed so far, they've been on medication, and now it is too far gone that we cannot save the patient's life. So yeah, self-medication is not the best option. If the patients can come see the doctors or the dentist, then we can be able to identify the deal with the problem. Let's not put it on the carpet. Deal with it now, so we're able to know, and it gives you a better prognosis of the outcome of the condition. Yes.
And this self-medication, do you think it is contributing to you have dental caries, or you have tooth decay on one tooth, and then it transfers to the next? Is it contributing to that?
So this is another myth that I really want to break. I really want to break it off. There is no tooth decay is not transferable in that aspect. What tends to happen is that, number one, you find that the patients who normally complain of this, the decay is happening between the two teeth. On one edge, okay? Now, the decay will not, or the bacteria will not choose to ioze moja iache ingine, itaozesha zote mbi, but one may be affected more than the other one, okay? So it does not jump from one to the other. No, you find that either it was in between the two. Another issue would be that now you find that you are chewing on this side, okay? Then you had a dental decay on one tooth, and it has been so bad you choose to now, because you're in pain, you choose to on the other side. So as you're chewing on this other side, because God made us equally having both sides, to chew both sides. So if you're overusing one side, you're helping it to now speed up the decay on the other side. So the person thinks that, kwani nimehama kutoka this side to the other side. No, because now you've not dealt with the one that was decayed. Now you've gone to that tree on the other side. Now you're exposing this teeth to the food, so the decay will happen faster. Yes, so it does not transfer from one tooth to another.
Thank you so much. Because we say there's
some you can see there's a worm. You feel like there's a worm moving.
And that is not actually true.
Yes.
Thank you so much for that kind of clarity. And another common issue is gum disease. Bleeding of the gum. People say it's painful. I don't even have to have brushed hard or anything. You're just chewing food and it is bleeding.
Yes.
How does that come about?
Sorry. Now, gum disease is, again, we go back to the basics, and I'll keep on saying that even when I finish, it is hygiene. Okay? So and as I demonstrated to you about the toothbrushing and the motion that I was suggesting, which was circular, when we need to brush our teeth at the deepest part of our gum, food tends to, the bacteria will produce what we call plaque, a whitish looking film that even you as a common person may not be able to differentiate that there's an issue. So this area, when it accumulates there, it now irritates the gum, okay, because it's something foreign to the mouth, and it irritates the gum, and since as it stays for a while, it becomes something hard that even your brush now cannot remove it. So this irritation tends to form the gum to become swollen, number one, to become red, okay, which we're now calling gingivitis. This is the first stage of gum disease, which is gingivitis. So there'll be pain, there'll be swelling, and there'll be some redness and some bleeding. Mild swelling. As it progresses, when we leave it, as it progresses, now that's when the gum disease we call periodontitis comes in, where now the food, what is happening, the bacteria is still accumulating, bringing more plaque. So when you see, let me use, sorry to use the word elderly people, you may find some people having some yellow, blackish thing that is stuck around. That is what causes the gum disease, because it's something foreign that is sitting there that is not coming out and can't come out with the brush, and it's irritating the gum. So as it's accumulating, what it does, it irritates, pushes the gum away, which forming a pocket, what we call a pocket, a more place to food to hide there, and it's eating away the supporting structure of the teeth, which is the gum and the bone. So as the bone, because every tooth, I think people normally assume that the teeth sit in just meat. No, we have bone under this. That is what is holding your teeth to sit there. So once the bone is being eaten away, because it sits like a glove, like it fits exactly like a key and a lock. As it's being eaten away, now what was holding to stay stiff is now what will cause the tooth to start shaking, because the bone is being eaten away, and the gum is also away from what was holding it. So yes, so that is what gum disease. So when a patient is presenting with the bleeding, maybe spontaneous, depending, we have to now differentiate, is it the gingivitis, which is normally reversible. If we just teach them the right way to brush their teeth, which will have to teach them the right way to brush their teeth, and maybe help them by washing them at the dental clinic to remove the plaque. But once that plaque is not removed, it progresses and it moves into the deeper part of the gum, which is now harder to clean, and as it's destroying this structure that cannot be brought back. Your bone cannot grow back, so we call it irreversible. So it's something that once it progresses, it can't go back to original how it was. What you can try and do is to alter it where it is, and try and save or just keep the teeth where they are till, but it's something the patient will have to have frequent washing, like 6 months, every 6 months, depending on the severity. There are some who have to wash every 3 months, depending on the severity of the gum disease. Yes.
Thank you so much. And the best thing about this episode is that most of the things you're talking about, it doesn't have to get there. We can actually prevent. We can address this if only we maintain hygiene and just brush the right way, like you've told us. So, Doc, we are winding up, and thank you so much. I think we are well learned today.
I hope so.
And we didn't give you a chance to tell us where we can get you. So as we wind up, I want you to talk to the community out there. If you have something you want to insist on, and also mention where they can get you.
Okay. Again, my name is Dr. Genevieve Care. I'm a dentist. I work at the Nyeri County Referral Hospital at the dental department. We really want to wish you as the community to appreciate this information and let it sink in and let it be part of your practice. If we can be able to just change things at the individual level, we may be able to prevent some common diseases that at the end of the day they're detrimental, but they can be preventable. Yes. As patients, I would really recommend if you can have your dental checkup twice a year. It doesn't have to be through me. Any dental professional that you can find around you, walk in, request. I would really like for you to check. Let me know how the status of my oral cavity, and leave there knowing what condition you have at it. Is there area that needs to be addressed, but not to wait till it is severe, because at the end of the day, you're the one who's going to lose your teeth. Teeth is people have tend to neglect and thought that it's normal to lose your teeth. But if you're to speak to the elderly people, they'll tell you they really struggle with eating. For example, there's someone who's not eaten meat for a long time. They have to eat soft diet foods because they can't chew properly. For the young people, the self-esteem, especially right in this day and age where your image is very important. So yes, let's take oral health as something very important. It's part of our general body, and we should take care of it just the same way we take care of the rest of our bodies. Yes.
Thank you so much. That's why you're going to be wrapping it up. Thank you so much for tuning in, and I want to believe that you've taken home a lot, and just brush the way the dog told us to, because yeah, maybe you were taught by your parent, maybe you taught yourself, but now we know the right way to do it, and let's start as early as now. See you on our next episode, and once again, your health is your wealth.